Here is your stem.
Okay, ma'am.
Okay, so if you read and understood, considering it surgical pathology station, please tell me what would be your provisional diagnosis?
Okay, it may be a case of carcinoid tumor or carcinoid syndrome.
Okay. What investigations would confirm your diagnosis?
I'll do some investigation. Firstly, I'll do the chromogranin A level in blood, then urinary 5-hydroxyindoleacetic acid, and
Okay.
immunohistological study for chromogranin B. And I can also do the CT scan, MRI, and octiotype scan.
Okay. Why would you go for extra CT scan and MRI when endoscopic guided biopsy was already done and that has already concluded it?
Yes, I want to see the metastasis in the other part.
Very good. For the sake of staging. Okay, very
Yes,
good.
ma'am.
All right. Okay. After you have confirmed your diagnosis, what would be your next step of management?
Management depends upon the patient condition and the stage of the disease. If the patient is symptomatic, I'll offer the somatostatin analog, that is the octreotide, and antidiarrheal drugs. If the lesion is less than 2 centimeter, I'll offer the resection. If it is the appendicular carcinoma, then I'll consider the appendicectomy. If the lesion more than 2 centimeter, in case of appendix, I'll consider the right hemicolectomy and ileocholic anastomosis, and
Okay.
including the regional lymph node clearance.
All these after discussing with MDT,
Yes, ma'am.
multidisciplinary team.
Multidisciplinary team approach.
Yes. First, you'll discuss with them and then all this. All right, good. Can you help me and read this, please? What exactly are you looking at?
Yes, this is the hematoxylin and eucin stain slide.
Yes. Showing?
It's showing the nucleoli.
Yes.
It's rounded or oval in shape
Yes.
and increased nuclear cytoplasm ratio.
Yes. Continue, please.
I can't say more.
Okay. Why there is different color in all these 4 slides? What does it tell you? Any guess?
No, ma'am.
Okay. Right. Can you tell me if there are any genes involved in the diagnosis or in the occurrence of carcinoid tumors?
Jane, I can say, ma'am.
You're not sure? Okay. What are the risk factors for this condition?
Okay, ma'am. It's mainly develops the patient who have the neuroendocrine tumor in their body when these are stimulated.
What
And the
is stimulated?
neurotransmitter.
Yes. So that means there is involvement of genes.
Yes, ma'am.
Which genes or which tumor markers and how to identify them? Yes.
I don't know the name of the gene, ma'am.
Carcinoid. Okay, tumors or syndrome, what is the difference?
It's a syndrome, a tumor when metastasis to the liver and not filtering by the liver, then they produce the symptoms.
Okay, what are the hormones which are produced by these tumors?
Yes, it includes the serotonin,
Okay.
bradykinin, prostaglandin, kallikrein, substance P, and histamine.
And how these tumors affect the life or the health of the person suffering from it?
Yes, they enters the liver via the circulations, and the liver when they reach the huge in number or heavy load, they cannot be metabolized by the liver and enters the circulation directly and produce the symptoms.
Okay, liver is one organ, but what is the most common organ
Yes,
which is affected?
appendix. It may be the
Okay,
appendix, small
appendix, but
intestine,
the
rectum,
lungs.
stomach, lungs.
Lungs are the most recently have presented with the large number of cases of carcinoid tumors. So, if a patient presents with carcinoid tumors, how would a patient present? What would be the different presentation that will
Yes, ma'am. Yes,
point
ma'am.
out to?
Patient may having the periodic abdominal pain, patient having the diarrhea or malabsorption, patient having the cutaneous flushing, especially face and the upper chest, patient having the cardiac problem like the valvular heart disease or fibrosis in the endocardium. Due to the bronchial constriction, patient may present with a wheeze or bronchial asthma.
All right, good. Can you tell me what are the different types of carcinoid tumors which are present in the lungs? If you
It's
could,
maybe the benign or malignant,
okay, or you could classify them
slow
into
growing or rapid growing.
typical and non-typical, or yes. So, any example you can give me? Okay, how would you differentiate a bronchial carcinoid from the carcinoid syndrome, or how would you differentiate? How would you tell me the difference
Bronchial carcinoid from, ma'am.
from the bronchitis or bronchial condition of the lung?
In other condition, inflammatory condition, there will be the increased CRP level, white cell count, and the ESR. But in case of carcinoid tumor, I will get the 5-hydroxyimmunolase acetic acid in 24 hours urine.
Yes, that is
And we also
diagnostic.
chromogranin A and chromogranin B will be present in case of the carcinoid syndrome, not in the other condition of the lungs.
If carcinoid tumors are present in the heart, how would a patient present?
Yes, patient may present with the uh, tricuspid or pulmonary stenosis or tricuspid regurgitation.
Yes, and there'll be endocardial fibrosis as well.
Yes,
Okay, how
endocardial
would you
fibrosis.
differentiate a patient suffering from carcinoid tumor with a patient suffering from an infective endocarditis?
And I will do the ECG and I will do the echocardiogram and the
Echocardiogram, yes.
yes and other marker for the carcinoid syndrome.
For infective endocarditis, what are the heart valves which are most commonly involved, who also present with valve thickening and stenosis?
Mitral valve? No, ma'am.
Um,
Tricuspid.
Tricuspid, and that is also common for carcinoid syndrome.
Yes, ma'am.
Yes, that
Ma'am,
is.
can you please tell me the gene involved in the
Yes,
carcinoid tumor?
yes, we'll discuss.